want to welcome from our Aboriginal Steering Committee at HELP our elder Reanna Erasmus. Reanna is a member of the Yellowknives Dene First Nation with roots in the Hupachesset First Nation. She joined HELP's Aboriginal Steering Committee in 2015. Reanna has been involved in education for over 40 years, from Aboriginal Head Start to post-secondary. In 2015, she was inducted into the Government of the Northwest Territories Education Hall of Fame for her work in early childhood. Reanna believes in lifelong learning and supporting all children to achieve their dreams. Thank you for joining us, Reanna.
Masi, good morning, everybody, and welcome to this exciting expo to talk about how COVID is affecting our children, our families, and our communities. My traditional ancestral name is Musqueam. I am speaking to you this morning from the unceded territory of the Hupachesset people. We are grateful to the Squamish, the Musqueam, and the Tsleil-Waututh people, where our Aboriginal Steering Committee used to meet before COVID. We'd like to say Mussy for allowing us on your territory. I'd also mention that we are all calling in or zooming in from many different traditional territories. So if you just give a minute to remind yourself about the unceded territory where you live and give thanks. Today is International Women's Day. And so I'd like to say to all the strong women in our lives, Mussy, to our ancestors, our trailblazers, our grandmothers, our mothers, our sisters, our daughters, our aunties, our nieces, and our friends. We're all amazing women who contribute every day. And I'm grateful for all of the strong women that are here. I'd like you to take a moment today to give thanks for all of the strong women in our lives, past and present. And also take a moment to say, Nasi, Gleko, to ourselves for looking after ourselves, our children, our families, our communities, and to remember that we are amazing women. Today, we're going to be talking about COVID and how it has affected our children, our families, and our communities. And I'm interested to hear the presentations, to hear what is happening. Personally, I can see when I do my Zoom calls with some people, I can see how with our adult people, how it's really affecting them. So in closing, I'd like to just give you a couple of poems, short poems by Rupikar. I stand on the sacrifices of a million women before me, thinking, what can I do to make this mountain taller so the women after me can see farther? A legacy. We all move forward when we recognize how resilient and striking the women around us are. I am surrounded by wonderful women at HELP and in my lives with my sisters, my daughters. Unfortunately, my aunties are all gone, but all those people, I say, Masi Cho, Gleko, all of those women, all of those trailblazers. We wouldn't be where we are today if it wasn't for them. And we are here today so that it makes it easier for the women behind us to have a better life. So Masi Cho, Gleko.
I have the great pleasure of introducing Dr. Jennifer Charlesworth as our first speaker today. Dr. Charlesworth has been British Columbia's representative for children and youth since 2018. Jennifer has worked in the BC social and healthcare sectors since 1977 in frontline child welfare, social policy, program management, and executive roles. As part of her extensive background in service of children, Jennifer has taught child and youth care at UVic and has been the executive director of the Federation of Community Social Services of BC. I have known Jennifer for a very long time. I won't tell you how long because that would give away our age. I'm very excited that we're renewing some collaborations. You may know that Jennifer managed to woo away our beloved Pippa Rowcliffe. And with that, we're looking forward to doing lots of collaborative projects between HELP and the representative office. So thanks for joining us this morning. Jennifer, over to you.
Thank you so much, Joanne, and I'm so grateful for the opportunity to join you and to participate in this gathering today. Thank you to Elder Doris and to Reanna Erasmus for starting us in a good way, and also for bringing in an awareness of the International Women's Day and the many women that are joining us today, and the many women who have lifted us up and who we have a responsibility to lift up going forward. So thank you for that. I'd like to start by acknowledging that I am joining the Expo today as an uninvited guest from the traditional and unceded territories of the Cena people, with close familial, cultural, and economic ties with the Lekwungen people on whose lands our Victoria-based office resides. And I'd like to acknowledge too the Métis and Inuit neighbors and friends who build community on these lands. On March 11th, 2020, almost a year ago, the World Health Organization declared COVID-19 a pandemic. It hit us like a hurricane, and we've all been living with the reality of it ever since. It upended our lives, and some of us completely. For today's expo, for example, it's happening virtually due to the COVID pandemic. Meeting, consulting, and learning online is our new norm, as are the many other precautionary measures that we have adopted and integrated into our day-to-day life. But while we've adapted in many ways, the impacts are not equal nor equitable. What I'd like to talk about this morning is COVID's impact on the children of BC, because for them, it has been dramatic and particularly intense. If we as adults feel our lives have been turned upside down, imagine what it feels like for a child. I'll speak a bit today about the data, patterns, and trends we have been able to discern through our work, our responses, questions that these trends raise, and the opportunity that COVID presents for new ways to respond. So I'm going to start by setting a bit of a foundation so that you know who our office is and what we do, so that you understand where our data arises from. The Office of the Representative for Children and Youth is an independent office of the legislature. I report to an all-party committee and not through a provincial ministry. So I report to the committee that is comprised of representatives from all the parties and who reports out to the Legislative Assembly. We're an oversight office overseeing and monitoring government services and programs that are delivered to children and youth and some young adults in BC. And we're also a rights-based organization. The UN Convention on the Rights of the Child, the UN Declaration on the Rights of Indigenous Peoples, and the UN Convention on the Rights of Persons with Disabilities all inform and underscore our work. At the RCY, we have 3 legislated mandated areas. And the first is advocacy, which is truly at the heart of the work that we do. These are our frontline staff who take calls, texts, emails, and online chat requests from young people, from families, caregivers, service providers, caregivers, and many others every single day. They help people navigate what can seem like a labyrinth of government services, and they support youth to have their voice heard. They advocate directly on behalf of children and youth and young adults when necessary. They're a busy group. We open between 1,500 and 1,800 new cases each year, and many of these include sibling groups, so the number of children served is far greater. Sometimes our involvement is brief, 1 or 2 calls, and other times we've been involved in the child's life for over a decade, with a total of 22,000 cases thus far. Cases are getting much more complex, and particularly in the last year, with multiple interests, services, and people involved. They are thus taking longer now to resolve. In fact, our time frame for involvement has doubled over the last few years. Our second program area is reviews and investigations. This team is responsible for reviewing and investigating critical injuries and deaths of children and youth in government care or those who've received reviewable services, which include services provided by the Ministry of Children and Family Development and mental health and addiction services delivered through health authorities and other public bodies. We are getting well over 300 reports every month, sometimes up to 380. And this fiscal year, we'll have reviewed 1,800 in some depth. And when you're working with this kind of information, trends and patterns begin to emerge. Some of these reports are thoroughly reviewed and some go to full investigation. Our investigations result in public reports on our findings with recommendations to support improvements in the systems and practices of care. Our third mandated area is monitoring. Staff in this area monitor, review, and conduct research and analysis on government programs and services and monitor the implementation of our recommendations. Monitoring identifies trends and patterns in RCY data and helps to uncover systemic issues. And we're incredibly grateful that Pippa Rowcliffe, formerly with HELP, has joined us as the Executive Director of Monitoring, and already we can see tremendous potential going forward. The work of our entire organization is supported by the First Nations, Métis, and Inuit Relations team. Given the dramatic over-involvement of the child welfare system in the lives of Indigenous children, youth, and families, it's critical that we bring an Indigenous lens to all the work we do. The First Nations, Métis, and Inuit Relations team helps us do that, building relationships with Indigenous leadership, grounding our work in Indigenous ways of knowing and being, and surfacing issues that are important to Indigenous communities. As part of our work on becoming a culturally safer organization, we've adopted an Indigenous approach that informs and guides all of our research and investigative methodology. We call it the 6 R's, and we're aspiring to embed this philosophy and way of being into our practice. These 6 R's are based on the work of Indigenous scholars and refer to the centering of relationships in our work, characterized by and supported by qualities of respect, relevance, reciprocity, and responsibility. That's 5. The 6th R stands for repair. Some might call it reconciliation or restoration. If relationships are at the center of our work, the concept of repairing harms encircles all that we do. It's our hope that by utilizing the lens of the 6 R's and sensitive Indigenous approaches, we can build trust and relationships, minimize trauma, raise awareness and understanding, and most importantly, improve experiences and outcomes for children, youth, and young adults. In addition, we strongly believe in following the principle of nothing about us without us, and therefore youth engagement is a priority for us. Our practice is to include youth perspectives as much as possible. As representative, I advocate for the rights of all children and youth in BC, but we have a special focus on children, youth, and young adults who are receiving reviewable or designated services from MCFD or other public bodies who are delivering child, youth, and young adult serving programs. So that's a brief overview of who we are. At the outset of the pandemic, we established a COVID response team to monitor government and community responses so that our advocates would have up-to-date information to support children and youth and their families, and to monitor and report any advocacy requests or reportable circumstances that had a COVID-related theme. We also looked for trends. We shared reports and discussed them weekly with MCFD and any other of the public bodies that were involved, including the Provincial Health Officer, for example. We noticed the impact on children whose lives were turned upside down almost immediately, particularly on children in care and their biological families and cultural communities who were not able to have in-person visits or participate in cultural activities, on children with special needs and their families and caregivers who lost virtually all of their supports. Over time, we learned more about rising mental health concerns and complexity, family violence, the severity of the opioid epidemic, and toxic drug supply and its impact on children. We identified several areas for further analysis, notably children and youth with special needs, mental health, substance use, family violence. So let's take a step back to see the bigger picture. Since the COVID pandemic began, we have seen and heard most from families who are deeply impacted. For children, COVID has resulted in multiple losses in their lives. I don't need to tell this group what has gone on as you are walking alongside children, youth, and families through these times. Children, like adults, have lost access to familiar structures, routines, and the relationships they value. This is particularly difficult for the youngest as they cannot understand why they don't have certain close people in their lives anymore. As a result, normative family development has been disrupted, and this can be expected to have long-term repercussions. Children can't go on play dates, go to birthday parties, celebrate transitions, participate in community and cultural events anymore. Or if they do, they look a lot different than they used to. Many children are witnessing the loss of a parent's employment and the resulting stress of the loss of family income. Younger children may not understand the issue, but they do feel and internalize that stress. And tragically, far too many children have experienced the loss of family members, either through COVID or through the toxic drug supply. These losses are immeasurable because they impact children and interrupt their development in myriad ways. As we monitored, learned, and discussed, it became clear that the pandemic had, of course, turned our lives upside down, but it was revealing and amplifying the fractures in the systems of care that existed prior to the pandemic. So let's take a closer look at a few of these. A key question that arose early on in the pandemic was, how will COVID-19 impact child and youth mental health? What might we expect in the months and years to come, and how might we improve outcomes? We realized that rapid research on those questions was necessary, and so we partnered with Dr. Charlotte Waddell and her team at the Child Health Policy Center at Simon Fraser University, and they produced 2 concise reports on the topic. The first in June took a look at ways in which online approaches could be effective in reducing childhood anxiety and what was evidence informed. And the second, done in November, took a look at what the impact of COVID-19 on children's mental health is likely to be based on research in other pandemics and natural disasters. This is what we learned. The evidence suggests that we can anticipate dramatic increases in the number of children and youth experiencing mental health issues as a result of the pandemic. These mental health issues include anxiety, depression, behavior problems, and PTSD. And let's put this in perspective. Prior to the pandemic, 12.7% of 4 to 18-year-olds had 1 or more mental health concerns warranting intervention. And only a fraction of those children were getting the help that they needed. Since untreated mental health problems can persist and become more acute over time, supports put into place now will significantly reduce future costs. This research suggested that in addition to the children who were already experiencing mental health concerns, we could anticipate that about 1/3 of our children, 30%, will experience anxiety, depression, PTSD, or behavior problems in such a manner that they will require interventions. It's important that we plan for that and that we attend to it. These reports provide clear evidence that government must invest in already underfunded child and youth mental health services to address and mitigate major increases in these concerns. The evidence suggests that there are many things that we can do, and that also there will be a disproportionate impact on a number of children, and we need to double down on ensuring that they are well cared for. Children and youth who are Indigenous, living in poverty, racialized, and experiencing special needs. Given chronic service shortfalls in BC, we can expect a lot of pressure on an overloaded system, and we need to reimagine what that system will look like going forward. The good news is that it's possible to create positive outcomes. The data suggests that children do well when their communities have more socioeconomic resources, when they have social supports, and when they receive effective parent support, suggesting that community and family health play significant roles in child and youth mental health. The November report received a tremendous amount of public attention and continues to. Dr. Waddell and I used that platform to reinforce the importance of ensuring effective mental health prevention and treatment services for all children who need it, and also to address the social disparities and effectively monitor and track collective progress. In this way, COVID-19 presents an unprecedented opportunity to make BC a place where the social and emotional well-being of all children is highly valued. The next area that we took a look at was children and youth impacted by the pandemic and who lived with special needs. On December, on the International Day of Persons with Disabilities, my office released a report on the impacts of COVID-19 on children and youth with special needs. This was another rapid research report, but done in a different way. It was done collaboratively with a large group of community partners who worked with families of children and youth with special needs and who are especially close to the issues. It came about because we were getting information from our advocacy team that families of children and youth with special needs were really struggling. Hanging on by their fingernails is perhaps one way of describing it. The challenges that every one of us faced in those first few months were compounded for these families. The closure of community centers was hard on everyone, but for children and youth with special needs, it brought a sudden end to vital therapies, programs, and support services in their schools and community. The suspension of in-class learning was a disruption, obviously, for every family with children, but it was disastrous for children whose families, who received so much of their therapies and supports while they were at school. And respite for families of children and youth with special needs vanished overnight at the start of the pandemic. And for many families, it actually remains that way. We realized that a crucial role for us in this pandemic would be to act as a convener, to bring together those people and organizations who work so hard for families of children and youth with special needs, and to amplify their voices. And when we drew in for a close look at the state of BC's special needs program in the pandemic, we found families at the breaking point. The economic impact has hit families of children and youth with special needs even harder, as the care needs of their child can mean at least one parent is unavailable for paid work. And that's a particular crisis for single parents. The impacts of the pandemic have disproportionately affected the 1 in 5 BC families who live in poverty, who are also disproportionately Indigenous, racialized, new to Canada, or led by single mothers, once again. The Ministry of Children and Family Development had begun working on a new framework for services to children and youth with special needs before the pandemic, and I used the report to urge MCFD to immediately re-engage community partners on the design, development, and implementation of that strategy. There's no instant fix, but all of us benefit when families are supported in raising children who are able to reach their potential. A couple of quick other areas. An area of great concern is whether the necessary measures to flatten the COVID-19 curve resulted in increased domestic violence and its effects on children. Any discussion of family violence must include child welfare. It's a part and parcel issue, not a separate issue. And it often plays a central role in our case investigations and our advocacy work. In April 2020 and again in February of this year, our monitoring team conducted some rapid research examining the increasing concerns about the impact on children of the restrictions put in place to control the spread of COVID-19. Again, necessary, warranted, but also there are unintended impacts. We looked at focused on violence directed towards children and increase in reports of child neglect. And as of last month, there have been very few academic publications based on peer-reviewed Canadian research. But that's not surprising given the time it takes to conduct such research. However, two key themes emerge when we take a look at the literature that does exist: the gendered inequity of economic stress and worry of family violence, and social isolation. The intersection of these two is the place of deepest concern. Child protection researchers and practitioners worry about the compounding impacts of shutdown measures. And there's a concern that social isolation may result in children being exposed to intimate partner violence. This just gives you a bit of a sense of the critical injury reports that we have received, and where we're seeing some significant concerns arise pertaining to violence. Emotional harm is one of the largest areas that we see consistently, and that takes a look at the experience of harm at the hands of caregivers, foster caregivers, residential care providers, and the harm caused by the loss of loved ones due to the opioid epidemic. It's a significant issue for us, and we're also seeing a rise in suicide attempts and suicidal ideation, sexualized violence, and of course, substance-related harm. We also, of course, have been taking a look at the illicit drug toxicity deaths. Fortunately, I can say that we're not seeing a dramatic increase during the pandemic of deaths. However, what we are seeing is an increased number of overdose events experienced by young people, and an increased number of children who are losing their parents, their grandparents, their aunties, uncles, and siblings as a result of the drug toxicity. Another area that I wanted to bring in is dimensions of belonging. This is an area in which COVID has had tremendous impact on young people. In one sense, it's an emerging area of study, and in another sense, it's been known for many, many, many years, generations upon generations, and illuminated by Sioux scholar Dr. Martin Brokenleg when he introduced us to the Circle of Courage model in 1988. It's a concept that we're focusing on in my office, and I think it holds promise as a way of thinking as we plan for a post-pandemic world. In the coming months, we're planning to release a report on the life of a First Nations girl who died tragically at the age of 17. In this report, we examine this young person's life through the dimensions of belonging that are so critical to child development. Relational belonging, referring to the importance of relations in a child's life, close trusting relationships, and of secure knowledge that those people will maintain the relationships. Cultural belonging, the importance of knowing one's roots, language, cultural worldviews, beliefs, practices, and spirituality. Physical belonging is in belonging to a place, a space, a home, a territory, a land. Identity, referring to the development of knowledge of who one is and where one fits in the world. And legal belonging, often understood in terms of adoption or transfer of guardianship. This investigation will show that this child's mom sought help and support and was denied what she needed. It will show that this young girl searched relentlessly for belonging in all the domains of her life, but was not supported well. As Dr. Brokenleg asserts, belonging is a fundamental need of all children and part of normative development. And this report will clearly demonstrate that. There's a compelling reason for this particular investigation. Although the child at the center of this work is no longer alive, and our hearts hurt whenever we consider that, it's important that we address this because it's the reality for so many children and youth, amplified by the pandemic. To broaden our lens, the losses children in BC have sustained so far as a result of the pandemic have impacted all these dimensions of belonging for them, and they'll require our collective action. I believe these concepts will be a way to think ahead. Think about how it is that we create those places of belonging and reinforce them as an antidote to the impact of the pandemic. There are many things that have gone well this past year. It's upended our lives, but we learned to pivot. We've learned to try new things. We've acted much more quickly than is typical. We've tried virtual and online services. Although they don't work for everyone, they do work for some, and for some, it works very, very well. Collaborative practice is something that the pandemic has pushed forward, and it has enormous benefits, especially in relationship building. So as we contemplate the future, we need to look critically at those activities we adopted out of necessity because of the disruption of the pandemic, and be careful to keep those that are working and not just drop them in our haste to get back to normal, because back to normal isn't really an option. I'm looking forward to our panel discussion later this morning to talk about how we might emerge from COVID, highlighting the bright spots we might build on to achieve better outcomes for children and youth. Thank you to all of you for participating today, and also for the work that you do every day in the well-being for children, youth, and families. Thank you. I'd be happy to take any questions.
Thank you, Jennifer, so much for that. And I just want to reflect on your closing with the importance of belonging and the work of Dr. Martin Brokenleg. So thank you for starting our day off with those reflections on the importance of belonging for our children. We have only a couple minutes for questions right now. So we do have one coming from Jennifer Westaby, who has a question about young parents who are in particularly challenging situations, often being under-resourced youth who are trying to cope with the situation and their own mental health, often on their own. She's wondering about if there's any particular research on the impact of COVID on this particular population. And I'm wondering if maybe just you could speak briefly to this group and if there's work taking place, or what you're focused on for this particular population.
Thank you. It's a wonderful question. There's no research that we have undertaken specific to young parents as yet. However, it's on our radar because for a couple of reasons. One is we've been focused a lot on the transitions into adulthood for many young people who have grown up in care, and we believe there's a moral and ethical responsibility to sustain those relationships. And of course, we do see a number of young people who've grown up in care, either having young children themselves while in care or shortly after in their young adulthood. And of course, they are dealing with a number of things as they emerge into their young adulthood, the trauma that they've experienced either coming into or during their time in care, and the disproportionate challenges that they face in terms of attaching to the labor force, stable housing, et cetera, et cetera. So we have been looking at the experience of young parents and the ways in which we can support those, particularly those who have been raised up in care. And absolutely, I think there is a disproportionate impact because the young parents are often living in poverty as well, and may have difficulties with respect to stable housing and secure neighborhoods and that kind of thing. So I think it's an important area for us to pay attention to, and to also think about what are the kinds of wraparound supports. Pippa and her team are specifically taking a look at how do we keep families safely together, and so young parents will be a factor in that as well.
Thank you so much, Jennifer. Kinwa, I think we have time for one more quick question. We've got one more on the list here.
Yeah, so bonjour, Jennifer, and bonjour, Indinwe Magdalena. So hello, all of my relatives. Happy to be here. I've been trying to ensure that I'm catching up with all of your reports so that people have a chance to at least review them, you know, as we go on or later on throughout the course of the day or the weeks, and to be able to follow up. We do have some questions rolling in, and so as people are coming, we'll be joining back and maybe circling back if other questions do pop up. But David Josie had a question around other ways that potentially we can be contributing to your advocacy efforts.
Oh, lovely. Well, we certainly welcome ideas or input to our central line. So you can always send things. In fact, anything that comes through the email to our intake call coordinators will pop up for me as well. So ideas and suggestions are always welcome. The other thing that we've been increasingly doing is reaching out into community organizations. Of course, we're an organization of 75 people, and we will never have the expertise that the people working in community do. So increasingly looking to community for advice and counsel on the things that we should be paying attention to. So I guess there's two ways. Reach into us, and also let us know what you're doing and what you're up to, and invite us into your world as well. The more that we have the opportunity for that reciprocity, that's one of our 6 R's, of exchange of information back and forth, the stronger we will be. The representative for children and youth is only as strong as the circle of people that is working with us and around us to hold us accountable and to raise things that are affecting community. And we do see significant differences across geography, across different populations. And again, that expertise is grounded in community. So again, reach out or invite us in for those kinds of conversations. We're happy to go wherever we are asked. We say yes a lot.
Is that one of the ways that potentially the RCY can help collect the data? Because you were mentioning about the lack of data that's involved in being able to capture sort of the domestic violence data and
Absolutely.
Yeah.
Absolutely. Yeah, and we're building some beautiful partnerships with the public post-secondaries and research institutes now. So there's source of data there, but again, there's practice-based evidence from community. So when you're seeing things, then please keep us posted of what you're uncovering or what you're curious about or what you think might be helpful. The other thing I should say too is that, you know, I'm one voice, but when many of us are speaking the same kinds of things, then I think that there's more likelihood there will be uptake. The Left Out report, Children and Youth with Special Needs, there have been dozens of people speaking in the same way, same with mental health. And I think that that's actually elevated these issues on the government agenda. So it's much more effective if we aren't the only voice. So share information, speak about the reports, put them in the hands of your MLAs. I think that helps us in our advocacy efforts too.
Thank you, Jennifer.
Thank you.
Thank you so much. Okay, we are going to move on and we will hear more from Jennifer in just a bit. So I'm going to hand it back to Joanne.
Great, thanks, Sally. Thanks, Jennifer. That was, lots to think about. I now have the great pleasure of introducing Drs. Hasina Samji and Evelyn Stewart who are going to work together on a presentation on their work doing a personal impacts of COVID survey and some of their early results. So Dr. Hasina Samji is an assistant professor in the Faculty of Health Sciences at SFU and a senior scientist at the BC Centre for Disease Control. She studies healthcare access for underserved populations, including people living with HIV, people who use drugs, and children and youth. Dr. Samji is the principal investigator on a project I'm very excited about, and all of us at HELP are, and that is the development of the Youth Development Instrument, the YDI, which will be a study measuring predictors of positive youth well-being, mental health, and development in high school students. So we're looking forward to doing lots of work together with Hasina. Dr. Evelyn Stewart is a child, adolescent, and adult psychiatrist and a clinical and neuroscience researcher. She is a professor of psychiatry in the Faculty of Medicine at UBC and is the founding director of the BC Children's Hospital Provincial OCD Clinic and Research Program. Dr. Stewart is also the research director for Children's Hospital Child, Youth, and Reproductive Mental Health Program, and she's a member of the BC Mental Health and Substance Use Services. Thank you both, Evelyn and Hasina, for joining us this morning. I think we're going to kick it off with Hasina.
Thank you very much, Joanne, and indeed to all of the HELP organizers for inviting us today and for your incredible work in advancing child, youth, and family well-being. I'd also like to wish everyone a happy International Women's Day. It's such a pleasure to be here speaking among such incredible panelists of women. Thank you very much. So as Joanne noted, let me see if I can advance our slide. Evelyn and I will be speaking this morning about a new survey looking at the personal impacts of coronavirus. We'll be presenting some of our early findings, and we're delighted to be presenting these to you this morning. Before we begin, we'd like to acknowledge that we are profoundly grateful to live and work on the unceded traditional territories of the Coquitlam, Musqueam, Squamish, Solo, and Tsleil-Waututh First Nations. Our goals this morning are to understand some of the mental health outcomes for children and parents during the COVID-19 pandemic, as well as share early results from the BC Children's PIC study. And here is a beautiful infographic developed by some folks at the BC CDC. The Personal Impacts of Coronavirus Study, or PICS, study is ongoing, and we look forward to sharing our preliminary results. But before we share the findings from our survey, we would like to start by thinking about some of the existing data, and certainly more data is coming to the fore, as Jennifer has noted. Research sometimes takes a little while, and we're happy to see that more and more research relating to child, youth, and family outcomes.
Recording in progress.
And more generally are coming to the fore, and we're understanding more about the impacts on all of these important population groups. And this is one such study undertaken by Mental Health Research Canada. And they're doing a series of cross-sectional surveys nationally. And here we're going to quickly look at some of the findings from their fourth poll. The results of the fifth poll, I believe, are now out. These findings are from December last year. And the survey looks primarily at adults at 18 plus, but certainly they look at parents of younger children. So what have they found to date? And the trends have been remarkably consistent. So they have found that the pandemic has had, unsurprisingly, a negative impact on the management of stress and mental health. These results show that prior to the pandemic, about half of Canadians say they were doing well in managing feelings of stress, anxiety, and depression. However, following the outbreak, the proportion who say they're doing well has decreased to just over a third. with a quarter, almost a quarter reporting, or just less than a quarter reporting they're not doing well. And what are some of these groups? Here on the bottom right in the red box, you can see who's actually handling stress relatively well. Well, those that perhaps have no children, so that's one group that we're going to expand on today. The older individuals, men, and those who haven't had contact with COVID personally are doing a little bit better. So that brings us to one of the key themes of our presentation this morning, which is that parenting during the pandemic has been incredibly challenging for a variety of reasons. And this shows some of the thoughts in a focus group: challenging, exhausting, hectic, and of course requiring extra levels of patience. Some of the other findings from the study describe how that Canadians that are most likely to rate anxiety high since the beginning of the pandemic are those that are younger, so 18 to 34, and this also is reflected in some of our BC data from the BC Speak survey that young adults are not doing so well. And this is in comparison to older people who seem to be ranking anxiety less highly. Parents with children in the home are also, as has been discussed so far, having a lot of challenge. And this study was able to break it down into different categories of age for children. So the parents of children between the ages of 0 and 8 were very likely to rate anxiety high, but those with older children even higher. And this is in comparison to those with no children in the home, which is 21%. Females were more likely to rate anxiety high versus males, frontline health workers, and those exposed directly to the pandemic in some way. And similar trends are noted with respect to depression. So we've noted that parenting during the pandemic is very challenging. What about with respect to child health, mental health outcomes? So far, there's been a systematic review looking at 12 studies, finding that the impacts on youth, mental health and well-being are related especially to depression and anxiety. But it also noted that there was a relatively low quality in the studies, and this is improving over time. But certainly there is a lot more needed in terms of providing youth the ability to share their own perspective and their own stories in the context of the pandemic. There was also a study that I'd like to highlight in China among Chinese adolescents. And what I'd like to note really is, well, the study showed that those with better nutrition and moderate high physical activity did better. And I think highlighting these resilience factors is also very much of interest in addition to simply noting high rates of anxiety, depression, and others. Those are important findings as well, but thinking about, well, what can we actually do to support young people? And so looking at the studies to date, there certainly are great limitations to our knowledge so far in understanding the impacts of the pandemic. Most of the studies focus on adults and only from one perspective. They're cross-sectional, and very few are collecting longitudinal data. So just looking at one point in time. And as we know, the pandemic is changing, our responses to the pandemic is changing. So it's important to capture some of that information over time. Clinical significance is vague. Sometimes they ask about feelings and thoughts, but not actually about what sorts of disorders are being observed. And there is very little focus on traditionally underserved groups, and we're going to talk a little bit more about some of those. And Jennifer has already outlined some of the groups that have been disproportionately impacted by the pandemic. So Evelyn and I, at the outset of the pandemic, doing work in this area of mental health and well-being for young people and families, felt that there would be tremendous impact of the pandemic. And we're really fortunate to team up and develop our study looking at these impacts in the larger population and focusing on certain subsets of the population where we thought that there may be disproportionate impacts. And we started the study, we started thinking about the study right at the outset of the pandemic, but really took 6 months to develop the survey in consultation with so many wonderful partners, including a partnership with Anxiety Canada and a number of ministry partners, clinical partners, and community partners. And we had some support from the BC Ministry of Health, the BC Centre for Disease Control, and from Anxiety Canada. And here is the graphic again. We did our official launch in February, so last month. And we're continuing to recruit. And so please do visit our study website if you're interested. Everyone is eligible to participate. And we're really keen to hear directly from young people themselves, and parents can consent their children to participate in the study. And here is the study website. And I wanted to also acknowledge so many incredible partners that spent time reviewing the survey, asking us to include additional questions that are most relevant to their populations that they serve, and also helping us distribute the survey. As we'll note, we're really keen to hear from the whole population, but certain groups in particular. So in general, we wanted to learn about the thoughts, feelings, and actions of people living through this pandemic, how these change over time. So we have a longitudinal study with monthly follow-up. And what are people's greatest needs, and what are the services that have been most helpful, and also identifying where there are gaps. So where would people like to see more services, and how would they like those services to be delivered? And we'll share a little bit about what we found in our preliminary results. Who are we especially interested in? Canadian families with children in the home and young adults are among some of the groups we're most interested in. Families with pre-existing physical and mental illness, learning differences, and systematically marginalized groups, those who are racialized, living in remote, rural, and urban settings, living in poverty. And our goal is to share the findings immediately with our stakeholders in government, in education, in health, and in the community, so that we can address both immediate needs and also prepare for future waves, which hopefully will not be the case, and as well learn so that we are prepared for future emergencies. And who can participate? So children over the age of 8 can participate directly, and I want to emphasize this again because we're so keen to hear from young people directly, and we'll be able to share some of our preliminary findings hearing from youth. And the study there are a few different surveys within the study. So there are surveys for adults, for non-parent adults, for parents, as well as youth directly. And so this is essentially hot off the press. These were findings we pulled from the survey on Friday. So we have currently recruited about 1,650 individuals. And so among those, in terms of adults that have been recruited so far, more than 500 are parents, and almost 700 are non-parent adults. And these actually can also represent adults whose parents are over the age of 18 and no longer living perhaps at home. We also have parents reporting on the health and well-being of their children. And so we call that, you'll see in the study, the parent proxy survey. And then hearing from youth directly. And we'd really like to increase this number of parents consenting their children into the study to share their own insights and perspectives. So many of the respondents are female, and this is particularly the case in the parent population. And the majority of the sample is currently white, and so we'd really like to increase the diversity of our sample, and we'll be doing more targeted recruitment. The other thing to note is that the parent sample is a little bit older compared to the non-parent sample, and you can see 50% of the parents are between the ages of 30 and 50, and not surprisingly, the non-parent sample skews a little bit younger, between the ages of 18 and 40. Our study is open to all of Canada. We also have some participants in other places due to our partnership with Anxiety Canada. And the sample is predominantly from British Columbia, and most of our partnerships and stakeholders also derive from BC. In terms of our recruitment, we are recruiting from a number of sources, including letters to patients who have been to BC Children's Hospital in the last year. So that's a new strategy that has never been used by BC Children's Hospital before. So we tested out a mail out, and we'll probably try and expand that expand our reach to those individuals, and social media, of course. And in terms of characterizing our sample, in terms of the parents, more than half are full-time employed, and just a little bit under half of the non-parent adults report full-time employment. As noted previously, there are some key populations that we would like to highlight. Families with a child or children with special needs, children and parents with pre-existing mental illness are another group that we think might have just disproportionate impacts due to the pandemic. Families with low income, visible minorities or racialized groups, and those living in rural, remote, and northern communities. And the reason families with special needs are highlighted is because we have now enough data to be able to share findings stratified by this group. And so we'll be presenting some of those findings. But for all of these other groups, we would like to continue to increase our recruitment and enrollment so that we can actually speak to the unique experiences of these various groups. And with that, I will hand it over to Evelyn to share some of our hot off the press findings from the PIC survey. Thanks very much for your attention.
Morning. Everyone hear me? I imagine I'll get a message if you can't hear me. Thank you so much for inviting Hasina and I to speak today. And I just wanted to start off by saying I'm so grateful to live and work on the unceded traditional territories of Musqueam, Squamish, and Tsleil-Waututh First Nations. And I recognize that today, there's going to be a lot that's jammed into 3 hours. And what really, my slides are going to have a number of lots of data and stats on them, but really the idea is to give a bit of a sense of where we're at now and what we've been able to glean from those 1,600 people who we're so grateful to who've taken the time to complete the survey. One of the initial things we wanted to look at was not just focusing on mental health specifically, because that would be assuming that that's going to have a greater impact than other areas. So we wanted to take a really broad look in terms of different domains of health, including physical, emotional health, social domains, and also quality of life. And then, as Hasina had mentioned, we also want to look at, to get a sense of what's the clinical need out there. So in other words, what are the rates of individuals in society who seem to meet criteria for severity of anxiety or depression, these types of things that would indicate that they need professional help. So here's a bit of a busy slide, but just to orient you, this is where we've asked about people about how their life is going in many different areas. So along the bottom here, you see physical health, and then mental and emotional health, quality of life, and relationships. And this, we've just pulled out the ones who've said things are not going well. So it's only fair or poor. And then within each block here, it's how they were doing at the start of the pandemic and how they're doing now. Because really what we're trying to do, one of the things with our survey is looking at not just having a snapshot of how are people doing at one moment, but what's happening. It's sort of this, certainly something I experience, and I think many of you as well, sort of this COVID fatigue or getting worn down over time. And certainly when we look at adults, the ones who are parents who are in blue, and the adults who aren't parents who are in orange, in each of these domains of physical, mental, emotional, quality of life, and relationships, there's a worsening over time. But the other thing to pay attention to is that really it's the area of mental emotional health that stands out, where people are saying they're just not doing well. We also asked about how kids were doing. We asked both from the kids' perspective to give a self-report and also from the parents' perspective. And here we don't see that kind of similar pattern of progressive worsening over time. But what we do see again is that according to the child's report and also the parents reporting about them, that the mental emotional health domain is where they're doing the most poorly. This is a slide showing the mental illness rates. So as I said before, I think it's helpful to get a sense of what is the clinical burden on society, on Canadians, so forth. And what we have here are the rates in our different groups. The blue group is how the child's doing from the parent's perspective. The orange group, and you'll notice it's a lot higher, is when you ask the kids themselves, they're saying they're not doing nearly as well as their parents think they're doing. The gray is parents and the yellow is other adults. And what you see here are rates for depression, generalized anxiety disorder. So that's not just worrying, which is a normal emotion, but it's worrying associated with dysfunction to a clinical level, and obsessive compulsive disorder. This red line, just to give you a sense of how magnified and way above what you would expect these rates are to show diagnostic rates. We weren't able to have a BC sample, but for the Ontario Child Health Study, so you can see they're much higher than we would expect in non-pandemic times. These are rates we were able to find from the Canadian Community Health Survey. So again, not BC specific, but kind of probably relatable to our sample for adults. And then this is sort of general known rates for OCD in the population. So what you see here is startling, and it's indicating that not just the kids, but particularly the parents and adults are doing quite poorly and in need of clinical care. There was a study that was done in Alberta back in the spring, where they interviewed people with the same measures we used, and they identified rates in the adults at that time. They didn't include children, but you can see that the rates that we get now is, well, it was a little bit higher for the anxiety disorder, but about the same for depression. So the big takeaway is the pandemic is having horrific effects on people's mental health. In terms of looking at combined disorders, so I just pulled this together after Jennifer had mentioned it, where they projected the rates of child mental illness. This is what we've been able to capture, just only looking at these 3 mental illnesses, but I think they're probably some of the primary ones. So by child self-report, nearly half of them have clinically significant mental illness, whereas a quarter of the parents think that their child has this one of these. And when you look at adult self-reports, 50 to 60%. So parents and adults are not doing well, nor are kids. In terms of looking at, we wanted to spend time not just finding what the problems were, but actually to find out specifically what are the needs and what are the services that people prefer. So about 3/4 of parents said they definitely needed some supports. And when we asked specifically where do they need supports most, they were again honing in on mental health. So managing their child's emotions, managing their own mental health or well-being, followed by a number of different other support areas. So again, yes, the theme is the mental health areas are the specific focus that is needed as reported by our families. And then when we asked about who do they want to provide this service, the top 3, although it was quite split, were psychologists, psychiatrists, and family or friends. And then this was a really important item. We asked people if they needed care but weren't receiving it. And about 20 to 30% of parents said that they needed care. And a question that came up at the last, after the last talk was kind of dividing parents, the younger, or dividing out adults and younger versus older. We split it up by looking at the parents who have preschool age kids, kids who are like 5 to 12, and then adolescents. And you'll see the parents of the younger kids reported having more needs that weren't received compared to that parents of adolescents. And then when we asked about not just what their needs are, but their ability to access support, about a third to 40% of parents said they actually had received some support. And again, we broke that down by age. So 43% of parents with preschool children had received support versus 38% for the child and 32% for those with adolescents. And then when we dove into what kind of support they've received, so if you remember a few slides back, we asked what they would want, and they said psychologist, psychiatrist, or family and friends. And here's what they actually got. So it was a private counselor, psychologist, family doc, and some self-directed support. And then of particular, we wanted to get a sense of, we've known there's been so many changes in all kinds of systems now, and that people have really had to make shifts in terms of how they provide services. So we wanted to get a sense of in what delivery people were receiving mental health support. And about a quarter of them was through online or virtual care, followed by phone, and then followed by in-person support. And then when we asked about barriers to accessing mental health support, the top ones were limited availability, COVID-specific aspects. So that would be, I imagine, not being able to go in person, limited time and cost. And I was reflecting a little bit about, so what can we do in response to what families are telling us? And certainly the system, I think, could look at ways of increasing availability, and something fairly straightforward to do would be to try and communicate or to try and address worries or doubts or limited knowledge about receiving mental health care. And then we asked about people whether their care improved or worsened or stayed the same through the pandemic. And in the circle here, the ones that are darker indicate greater worsening. So what we found was that a quarter of individuals reported that their mental health care worsened during this time, even though the need for mental health care increased. So in terms of future analyses, I think I just gave you a quick overview of some of our initial findings, but certainly we're really pushing hard, begging and pleading anyone, and I'll beg and plead now, if any of you are willing to either complete the survey yourself or to send it to your communities, it would be really fantastic. We're aiming towards 3,000 so that we can do the secondary analyses and get some answers for guidance in terms of how to improve outcomes. So we'll be looking at things like the influence of child and parent vulnerability factors, such as whether they're in person in school or virtual, for example, impacts of exercise and outdoor time. So to follow up on the studies, the previous studies that Hasina talked about, impacts of things like video game use, substance use, ethnic and gender identity. And then I think really one of the biggest things that we're wanting to find is change over time. So the way we've set up the survey is hopefully, if and when COVID ends in a few months, we'll be able to continue following people into the new normal, whatever that's going to be, and see how people are adjusting or readjusting or not. So in summary, we developed a PICS survey with a great deal of input from those in the community. We've recruited 1,500 to date, so we're halfway. But really what we found is it's the mental and emotional health aspects that are disproportionately affected. And it seems to be worsening, particularly in adults over time. The rates of specific psychiatric disorders are 3 to 4 times expected. And supports are needed by the large majority of parents, but obtained by a smaller proportion. And there's also reports of care worsening. So again, I encourage you to show one more picture of the survey. It's called the PICS survey. So you could find it by just Googling BCCH and PICS study. Thank you so much.
Great. Thank you so much, Evelyn. There's so much richness there. I think we at HELP are a little bit ambitious about how many speakers and how much wonderful content we were going to fit in this morning. So what we're going to do, I think, is move on to Magdalena's presentation. For Q&A, I really want to encourage everybody to put their questions into the Q&A function, and we are asking that Evelyn and Hasina will answer the questions in that way, and then we can also get questions to them after the fact, so that if you have those questions that you really need answers from that information, then please participate in that way. I think we'll do the same thing for Magdalena. That'll help us get ourselves back on time and have lots of time for the dialogue. So briefly, Magdalena Janus, professor at the School of Population and Public Health, HELP faculty member, professor at the Offord Center at McMaster University, co-developer with Dr. Dan Offord of the Early Development Instrument, and dear friend. Over to Magdalena.
Thanks very much, Joanne, and everybody. I'm speaking today from the traditional territory of the Mississaugas of the Credit First Nation of the Anishinaabe peoples. Thank you very much for letting me to share some thoughts with you again today. For this talk, I chose to focus on the impact of school closures on fairly specifically, as access to school is a very important social determinant of health, and it impacts a proxy for a larger impact of the pandemic, and it will complement to some extent the talks that you've already heard. However, I would like, before I start, to take advantage of today being the International Women's Day and acknowledge the 4 women who were my role models and inspiration. My grandmother, Maria Fredewicz, my mom, Zofia Cisielska, Maria Skłodowska-Curie, and Jane Goodall, and I can tell you why some other time. Far from being a source of academic learning only, for many children, school-based learning occurs through social interactions, ability to practice self-regulation skills, growth of persistence and self-confidence, and development of physical health occurs through access to sports and physical activity at school. Schools also provide space where children with special needs can learn better, with accommodations required that are not always possible to receive at home. And sadly, for some children, schools are also places safer than home, and they are sources of meals that may be more nutritious than those available at home. So it's really important for us to understand the impact of school closures. The context that Hasina kind of alluded to a little bit was much of what we knew early last year was based on quite a lot of evidence, because schools have been closed on a regular basis for snow days, environmental disasters, labor disruptions, and even earlier pandemics. What made the difference this time was this quick switch to at-home learning, with expectations of it kind of happening almost exactly the same as before, without preparation or infrastructure. That was really quite a new thing, because in other cases, learning was usually impossible. So not surprisingly, again, as has been said before, major negative impacts were expected due to, like all proper social determinants, acting at the child level, at the parent level, or a family. And I will be talking a little bit both about children and parents, but I will not be able to address the differential impact on families along the socioeconomic and racial fault lines today. And I refer to parents, but I do mean parents, guardians, and caregivers. So what have we learned about learning from home? And majority of the findings I'm going to talk about today are coming from the first wave, impact of the first wave. We do know now that COVID-19 obviously is not a snow day. A year after, how did the school closures impact learning of children in kindergarten? What we found in a survey of kindergarten educators in Ontario, run between May and July last year, that majority, more than 90% of our educators started distance learning by the first week of April. About half interacted with individual families at least once a week, which is good, but that means that about half did not do that. Half had access to the resources needed. That means that the half did not. And 3/4 of them reported longer preparation time than before to their classes. And what is actually really important to remember if we think about children's learning is that their online interactions with children lasted 30 minutes or less for about half of those who responded. Good news was that over 80% of the educators that responded, and about 3,000 of them responded to our survey, were in touch with the parents of each student in their class at least once. But at the same time, the 11% said that despite their attempts, they were not being able to reach them. And over 80% reported that there were children in their class whose parents opted out of distance learning. And that's the population that who are not going to respond to parenting surveys and maybe ask for help in a way that help could be provided easily. What happens to children's mental health? You heard a little bit about it already. But I chose this study to tell you a little bit about, because it's one of the best is because here my colleagues from Sick Kids in Toronto followed cohorts they've already been collecting longitudinal data on. So what they were able to do was to compare the responses during the first wave with the responses of these families about their levels of mental health prior. I only chose a subgroup of the study that they reported on. The youngest ones. And what you see is that these two kind of levels take the majority of the graph. So for majority of the children, it was either the same, which is the middle part of the graph, or worse, which is the bottom part of the graph. Things did improve a little bit for a very small proportion of children, and they improved most for the hyperactivity disorder for the youngest group of children. So this suggests that there is some uniqueness to the impact of the school closures and pandemic on each family and each child. Ontario Parents Survey was run more or less at the same time, and very much echoing the results that Evelyn and Hasina presented. We found that 57 of caregivers, parents met the criteria for depression using the same methodology as you've mentioned, and 30% for anxiety. In our study of adults, of kindergarten educators, we found very similar, with exactly the same methodology, we found exactly the same very similar levels of both depression and anxiety. But what I think the twist that I kind of cheated a little bit with the title, because I said teachers, but I really meant parents. Educators are parents too. 61% of the educators in our sample had children under the age of 18. We also asked them, somewhat kind of predicting what might be the biggest impact. We asked them whether they were primarily responsible for teaching and looking after their children, or whether they shared this responsibility. And so we looked at those two groups separately. So the top graph on both is everybody, the second is parents. But the third, the group that experienced the highest level of anxiety and depression are parents who said that they were primarily responsible for looking after and teaching their children. In contrast, the group that showed the lowest levels of anxiety and depression were parents as well, but they were the ones that reported shared responsibility. And clearly, the difficulty balancing work and caring for children, especially in the environment where schools are closed and children are supposed to learn at home, is a contributing factor. This just quickly, I just wanted to say that in our findings that parents seem to be experiencing higher levels of stress. It's not just happens in our sample. In another national study of adult Canadians, parents had consistently higher levels of both anxiety and depression, with one exception. So, school closures clearly create difficulties in terms of work-life balance and increased stress, but hopefully they are really effective mitigation strategy for prevention of COVID-19 incidence and prevalence and deaths. Well, unfortunately, no. A study from the US, also done in the first wave, compared impact of behavioral changes such as not dining out, working from home, using hand sanitizers versus school closures. So the behavior changes are blue and orange are school closures. And they found that the behavior changes had 3 times stronger association with preventing COVID-19 incidence and mortality than school closures. So there are less harmful ways to prevent COVID-19 infections than mandatory school closures. And the lack of work-life balance is clearly disturbing the well-being of parents. As a researcher, I often talk about study results without suggesting action. So it struck me here that these strategies that are being used to address burnout among healthcare professionals are highly applicable to parents who are professionals on the front lines experiencing burnout and mental distress. So they need to be listened and heard. They need to be protected, not just through individual family networks, but through government support and communities. Their needs need to be addressed. They need to be prepared, given resources, supported in need, as Evelyn just indicated, and they need to feel that they are cared for. I think individually, what we are seeing so far, that most children adapt reasonably well and perhaps will be stronger due to their experience of coping. Parents, however, experience higher risks for mental distress under the pandemic, struggling with work-child care balance. So ultimately, in order for our children to be healthy and resilient, we also need healthy and resilient parents. And they have to be nurtured through parenting and health supports, through childcare, income security, and sick leave. But we likely do not need school closures as mitigation strategies. Thank you for listening.